Hey everyone, it's Dr. Mike, and today we're talking about a condition that can bring even the toughest among us to our knees: kidney stones. Imagine this: you're going about your day, feeling fine, when suddenly, bam! You're hit with a pain so intense you can barely think straight. That, my friends, could be kidney stones. Kidney stones are hard deposits that form in your kidneys, and trust me, they're not something you want to mess around with. Early detection and treatment are key to avoiding some pretty nasty complications. In this video, we're going to break down everything you need to know about kidney stones, from the common symptoms to the most effective treatments. So grab a glass of water, staying hydrated is crucial. Get comfy and let's dive in. Let's talk about the most notorious symptom of kidney stones, the pain. And guys, I'm not talking about your average ache or twinge. This pain is severe, often described as sharp stabbing or cramping. Imagine the worst pain you've ever felt: a broken bone, a really bad burn, and then multiply that by 10. That's the kind of pain we're talking about here. This pain typically strikes in your back, side, or lower abdomen, right where your kidneys are located. It can come on suddenly, often without warning, and can last for minutes or even hours at a time. What causes this excruciating pain? Well, imagine a sharp, jagged rock trying to make its way through a narrow tube. That's essentially what's happening when a kidney stone tries to pass through your urinary tract. The stone irritates and scrapes against the delicate lining of your ureter, the tube that carries urine from your kidney to your bladder, causing intense pain and spasms. If you experience this kind of sudden, severe pain, especially in your back or side, don't try to tough it out. It's crucial to seek medical attention immediately. Now, let's talk about another telltale sign of kidney stones, pain or burning during urination. You know that feeling of relief when you finally get to go? Well, imagine the opposite of that. Instead of a sense of relief, you feel a sharp burning sensation that can radiate from your lower abdomen all the way down to the tip of your urethra. This is another sign that a kidney stone is on the move. As the stone travels from your kidney into your ureter, it can irritate and inflame the lining of your urinary tract. This irritation is what causes that painful burning sensation when you pee. Now, it's important to remember that pain during urination can also be a symptom of other conditions like a urinary tract infection. But if you're also experiencing that severe back or side pain we talked about earlier, it's even more likely that a kidney stone is the culprit. So if you're feeling the burn, don't ignore it. Make an appointment with your doctor to get checked out. Ever feel like you're constantly running to the bathroom, even when you just went? That frequent urge to urinate, my friends, could be another sign of kidney stones. Think of it this way: your urinary tract is like a highway, and those pesky kidney stones are like roadblocks. As a stone moves through your ureter, it irritates the surrounding tissues, sending signals to your brain that you need to pee, even if your bladder isn't actually full. This constant urge to go can be incredibly disruptive, making it hard to concentrate on work, sleep through the night, or even just relax and enjoy your day. Now, I know what you're thinking: Dr. Mike, I drink a lot of water. Could that be why I'm peeing so much? And you're right, staying hydrated is incredibly important, especially if you're prone to kidney stones. But if you're drinking your fluids and still find yourself constantly running to the bathroom, especially if it's accompanied by pain or burning, it's time to get things checked out. All right, let's talk about a symptom that's definitely cause for concern: blood in your urine. Now, seeing blood in the toilet bowl can be alarming, and rightfully so. It's not something to ignore. When it comes to kidney stones, blood in the urine or hematuria occurs when the stone scratches or damages the lining of your urinary tract. Remember that sharp, jagged rock we talked about earlier? As it makes its way through your ureter, it can cause tiny tears and abrasions, leading to bleeding. The amount of blood can vary. Sometimes it's just a few drops, barely noticeable, while other times it can be enough to turn your urine pink, red, or even brown. Now, I know it can be scary to see blood in your urine, but try not to panic. Not all cases of hematuria are serious. However, it's essential to see your doctor to determine the underlying cause and get the appropriate treatment. Let's face it, no one loves talking about urine, but trust me, paying attention to what's going on down there can be a lifesaver, literally. And that brings us to our next symptom: cloudy or foul-smelling urine. Normally, your urine should be clear or pale yellow and relatively odorless. But when you have kidney stones, your urine can take on a cloudy appearance or develop a strong, unpleasant odor. Why does this happen? Well, those pesky kidney stones can create a breeding ground for bacteria in your urinary tract. And as you know, where there's bacteria, there's often a bad smell. Cloudy urine can also be a sign of pus, which is your body's way of fighting off infection. So if you notice your urine looking murky or smelling funky, it's a sign that something's not right and you need to see your doctor. Now let's talk about a couple of symptoms that might seem unrelated to kidney stones, but are actually quite common. Nausea and vomiting. When you're dealing with the intense pain of a kidney stone, your body goes into full-on panic mode. It's like your body's internal alarm system is going haywire, sending signals to your stomach that something is seriously wrong. This can lead to feelings of nausea, and in some cases you might even vomit. Think about it this way: your kidneys and your digestive system are closely connected. When one is out of whack, it can throw the other one off balance. So, while nausea and vomiting aren't always present with kidney stones, they're definitely something to watch out for. If you're experiencing these symptoms, along with any of the other signs we've talked about, it's important to seek medical attention. All right, let's talk about a symptom that's a major red flag: fever and chills. Now, while kidney stones themselves don't usually cause fever, they can increase your risk of developing a urinary tract infection, or UTI. Remember how those stones can create a breeding ground for bacteria? Well, if that bacteria spreads to your bladder or kidneys, it can lead to a UTI, which can cause fever, chills, and even more pain. A fever is your body's way of fighting off infection, but if left untreated, it can quickly escalate into a serious medical emergency. So, if you're experiencing fever and chills along with any other kidney stone symptoms, it's crucial to seek immediate medical attention. Let's talk about a symptom that can be both painful and incredibly frustrating: difficulty passing urine. You know that feeling of relief when you finally get to go? Well, imagine the opposite of that. You feel the urge, you head to the bathroom, but nothing happens. Or maybe you can only go a little bit, and it feels like you have to strain or push to get it out. That's what it can be like when a kidney stone is blocking your urinary tract. Remember that highway analogy we talked about earlier? Well, imagine a massive traffic jam caused by a stalled car. That's essentially what's happening when a kidney stone gets stuck in your ureter, blocking the flow of urine. This blockage can cause a buildup of pressure in your kidneys, leading to pain, discomfort, and even damage if left untreated. So if you're having trouble peeing, don't ignore it. Seek medical attention right away. Have you ever felt like you constantly have to pee, even when you just went and you know your bladder is empty? That persistent need to urinate, even with an empty bladder, can be another sign of kidney stones, especially if they're lodged in the lower part of your urinary tract. It's like your body is sending you mixed signals. Your bladder is empty, but the irritation caused by the stone is still telling your brain that you need to go. This can be incredibly frustrating and disruptive, making it difficult to get through your day without constantly searching for a bathroom. Now, it's important to remember that this symptom can also be caused by other conditions, such as an overactive bladder or even anxiety. But if you're experiencing this persistent urge along with any of the other kidney stone symptoms we've discussed, it's essential to see your doctor to get a proper diagnosis. So there you have it, 9 common warning signs of kidney stones. Remember, early detection and treatment are key to preventing serious complications. If you're experiencing any of the symptoms we've discussed, don't hesitate to reach out to your doctor. Kidney stones can be incredibly painful, but with the right treatment, you can get relief and prevent them from coming back. Remember to stay hydrated, eat a healthy diet, and listen to your body. If you found this video helpful, give it a thumbs up, share it with your friends and family, and don't forget to subscribe to my channel for more informative videos on staying healthy and feeling your best. Until next time, stay healthy.